A few years ago, my grandpa and I climbed one of the highest mountains in China. It was the one that inspired Avatar, and because he'd just seen the movie, he was fully committed to the experience. He was jumping around near the cliff's edges, pretending he was leaping on dragons. He was acting like an 8-year-old kid, and Mom was horrified for his safety. Towards the end of that hike, Grandpa turned to me and he asked, "What if this is the last time I'll see you?" Go on, Grandpa. Are you actually going to jump off that mountain? Stop talking like that. Grandpa is so healthy and so full of life. Of course he's going to live forever. And then a few months later, I get a call. Grandpa's been diagnosed with cancer. It was a hair on fire situation, and we were completely blindsided. Which type of treatment should he get? Which medicine, which doctor, which hospital? How will we even pay for all of this? And just like that, our world had turned upside down. Grandpa needed full-time care, and Mom decided to just drop everything so she can fly to China and be there with him in person. Her own health nearly collapsed. And with dark circles underneath her eyes, she would tell me, "But I'm just being a good daughter." Like Mom, most caregivers don't know they are caregivers. And because they don't identify as such, they don't know they deserve to be seen and supported. Most of them just think, "Oh, I'm just helping out Mom. I'm just helping out Dad." They don't know they're caregivers. And like Mom, there are 53 million people in the US providing unpaid care for family and friends. And if their work were to be paid, it would be worth $600 billion US. And before you think, well, this doesn't affect me, let me ask you, who will take care of your parents when they can no longer take care of themselves and they need help with getting out of bed or eating or bathing? And before you think, "Oh, I'm just gonna hire someone," consider that in-home care costs $75,000 US a year, and that only covers 40 hours a week. What happens at nights? What happens on the weekends? Most families simply cannot afford this. And nursing homes and assisted living facilities are just as expensive, and the average US senior can only afford 1 year of it. And then what? We are on the precipice of the greatest aging crisis in history. Life expectancy has been rising, birth rates has been declining, and in just 8 years, 1 out of 5 US citizens will be of retirement age. And more than half of those people will need help with their daily activities. There simply won't be enough young people to care for the aging population. And our system is completely unprepared for what is coming. Today, I want to talk about 3 key changes that we need to make. One on a personal level, one in our workplace, and one in our policies. Let's start with what you and I can do. Start planning early. Think about it. We plan for our weddings, we plan for careers, we're even planning for spring break, but we don't plan for care. And the reality is that most people just don't want to think about these issues until they're being forced to, and by then it's often too late. When a crisis hits, you'll have less than 24 hours, maybe the same working day, to make really difficult decisions with a very limited amount of time and very limited information. When my grandpa wanted to have these discussions with me, I told him, "Don't talk like that." But the typical cycle of misconception goes like this. Adults think that their spouse will take care of them. The parents think that their children will take care of them. And their children think that Medicare will take care of everything. In reality, Medicare only covers for the medical event itself, not the stroke or the fall is very often not the real issue. It's everything that comes after. And that's why we need to stop avoiding the difficult discussions and start taking inventory together as a family. Who will be taking care of your parents when they can no longer take care of themselves? Who will be making medical and financial decisions, such as the will or the power of attorney? Who will be paying for all of this and contributing financially? Is it you? Is it your sibling? If we don't have these important discussions now, they will happen later in a hospital room during a crisis, not really moments when you want to be making life-changing decisions. Still, personal planning can only take us so far. We need our workplaces to step up as well. Imagine getting a phone call that your mother or your father has suffered a stroke. What would you do? Would you drop out of school? Would you walk away from your dream job? Would you ask your sibling to do everything for you? This is the reality that millions of people face. 40% of caregivers drop out of work or reduce work hours, and women are 3 times more likely to leave their job when a loved one falls ill. But investing in caregiving isn't just the right thing to do, it's also smart business. According to a study found by Harvard Business School, for every dollar that a company invests in caregiving support for its employees, it can save $3 or $4 by reducing the turnover and increasing retention rates. And luckily, we have more companies starting to lead the way on this. We have Deloitte providing up to 4 months of paid leave for family members that need care. And then we have also companies like Microsoft are providing 150 hours of backup care for elders and children. The reality is that most of the workforce falls under the sandwich generation. They're taking care of both their parents and their children. But just don't make us choose between our loved ones or our career. And don't make us choose between our parents or our children. Finally, governments must act. Right now, no matter how much money you have, there is no public or private long-term insurance that can cover for care. And this significant financial risk falls on the families alone, but it shouldn't. Right now, 76% of all care is provided by unpaid friends or family members. And these people are paying out of pockets, bankrupting themselves before they can qualify for government aids. We already have countries like Japan and Germany that are providing public long-term care insurance, and they're funding it by taking out a small amount out of the workforce's paychecks so they can pay for care of those that need it. As a society, we should start thinking about spreading this risk of care, just like we do with Social Security and healthcare. In the end, care is not just a personal responsibility, it's a societal one. And we need to bring these important conversations to the forefront so we can start developing solutions that can solve these issues from a systemic perspective. I think back on that moment up on the mountains with my grandpa all the time. The wind in his hair, the way he looked at me when he asked if this was the last time that we'd ever see each other. I didn't know that COVID would happen. I didn't know that the borders would close. And I didn't know that was our goodbye. But life is incredibly fragile. And we don't get to choose how much time we have. But we do get to choose how we show up and how we care for those we love. One day, someone you love will need care. Will you be ready?